serve about 25,000 patients a year through our case management portfolio, which is where patients present to us and have a number of different problems, and we do what we call, it's basically an open-ended intake assessment where we really try to understand. It's almost like someone coming into we call it the emergency room for affordability and access. So what are you here for, sort of thing. So this is not necessarily knowing what they're here for, but just asking them. The number one thing that patients ask for assistance with is copay, but for doctor's visits and hospital bills. The second thing is transportation. The third thing is copay assistance for pharmaceuticals. The fourth is utilities, and the fifth is rent. And there's a reason for that. I already alluded to it before, because they're making trade-offs between affording their insurance care and their medical care and their ability to afford their everyday care. And those things kind of bundle at the top. There's really not any statistical differences between those. That's just the order of them. But they all fall within a range where that's sort of the bundle of things that patients, at least the low-income patients that we're helping, are presenting to us with. And so going back to your conversation about cost, I think in these patients in our surveys, about half the time they are trying to understand what the cost implications of their care are before they start care. So they're already seeking, many of them, that cost. What is the cost burden going to be? They're also, I think I agree with you, I have a whole family of practicing physicians, most of whom are and healthcare providers who are in oncology. I think the patients think about the same things. You know, what is my chance of survival? All right, beyond that, then what are my chances of progression-free, of controlling the tumor, the other things that you mentioned? And they also think about the side effects. I think they'd love to have that conversation with, many of them will, not everybody, but tell me the options. What are the different trade-offs between them? But I also think patients, well, at least what we see, particularly in low-income patients, they're willing to make pretty significant trade-offs in their life in order to pursue a treatment regimen that either their provider has told them is the best option for them, or even better, that they understand what the risks and benefits are, and they know what the financial risk is, and they're willing to take it. So I think that's what I guess what concerns me about some of this is making decisions beforehand about what a patient can or cannot afford, and either limiting choices or directing them in certain ways based on some presuppositions, rather than just, no one's mastered it yet, how to have that cost conversation, when to have it, how to do it in a productive way with patients, but it is important.
But I'm glad you said that and put it in perspective, and I'm going to keep coming back to this over and over again. Look, the drug piece is something that has to be solved. I have talked to the leadership, as Ira knows, of Janssen. I've talked to the leadership of Lilly, and I've said to all of companies, I said, the drug price is an issue. It has to be addressed. But we have to put in perspective that even though we come back to the drug piece all the time, there's a big other world out there. There's 80% of the pie chart that are other costs associated with cancer care, and then there's the third dimension of where that care is delivered, because there are differences when it's in a community oncology and independent practice, when it's at the hospital and a large health system side. So I'm glad you said, Alan, that, and you made it clear that patients are calling in not just saying, how do I get my drug copay, but how do I get my hospital copay? How do I get my copay associated with my physician's visit, or radiology, or radiation, any other aspect of it? We've got to be clear about that, because I can tell you right now, and again, I underscore, and I'm saying it, and I say it with two representatives from drug companies here, it's a problem.